This is a technique for suture button fixation and knee snot cerclage for Neer type 5 distal clavicle fractures. Here is our disclosure. Neer type 5 distal clavicle fractures consist of a small lateral fracture fragment, which is often comminuted, and an inferior fracture fragment, which is attached to the corticoclavicular ligaments of the conoid and trapezoid ligaments. Here is an X-ray depicting a Neer type 5 distal clavicle fracture, and a correlative CT scan demonstrating a small, often comminuted lateral fracture fragment. The procedure is performed in the beach chair position. A longitudinal incision is made in line with the clavicle and acromion. The base of the coracoid is exposed, and small Homan retractors are placed around the base of the coracoid to isolate it. A cannulated drill bit is passed from the distal clavicle through the base of the coracoid, and a right angle clamp is used to retrieve a nitinol wire out the lateral aspect of the base of the coracoid, and a passing suture is placed through the base of the coracoid and the distal clavicle. The suture button construct is then put together with a fiber tape and a tight rope from Arthrex passed through a Arthrex dog bone button. This is then placed through the open incision through the use of the passing suture to the base of the coracoid, and then two 2.0 millimeter drill tunnels are placed at approximately 25 millimeters from the lateral aspect of the distal clavicle and 40 to 45 millimeters from the lateral aspect of the clavicle. A Houston suture passer is then utilized to pass the fiber tape through the more medial conoid tunnel and the Arthrex tight rope through the lateral tunnel, and then dog bones are placed through those sutures. Two number 2 fiber wire sutures are then passed with the use of a curved hemostat around the posterior aspect of the clavicle and under the inferior clavicle fracture fragment for later knee snot application. Then, using large C-arm fluoroscopy, the tight rope is then tension with use of the dog bone to reduce the clavicle fracture fragment down to the inferior fracture fragment. The fiber tape is then tied, and the knee loops are then tied with a knee snot with 4 half hitches, and final fluoroscopy and x-rays are obtained, and this completes the technique.